Yeah. Ah.
Okay.
Cool.
You might be recording. I don't know. We'll find out later. So anyway, we going to do mental health, or we like going to eat popcorn and pears and stuff? The basis for the billing of mental health services comes from a diagnostic setup, okay? But anyway, here's my slideshow I'm going to subject you people to. This is what you get for showing up. A mental disorder is a clinically significant behavioral or psychological syndrome or pattern that occurs in an individual and that is associated with present distress as a painful symptom or a disability, an impairment in one or more important areas of functioning, or with a significantly increased risk of suffering death, pain, disability, or an important loss of freedom. Okay? That's a mental disorder. This is multiaxial. Huh? Did somebody say something? Okay, I thought I was rambling, which is what I tend to do. There's a multiaxial assessment device that's used universally to classify all this. This is when you get into billing criteria too. But it's also used in a psychological workup. You got 5 different axes, okay? Axis 1 is in regard to clinical disorders or other conditions that may be a focus of clinical attention. If it doesn't need a definition, it could still be a consideration. Axis 2 includes personality disorders and mental retardation. Axis 3 is general medical conditions where you'll find a physical diagnosis. Axis 4 is psychosocial and environmental problems. They're not a specific diagnosis, but if somebody's having, a relational problem, they're breaking up, they're getting divorced, or a problem with a child or work or law enforcement, those things would fit under here. Axis 5 is a global assessment of functioning.
Hi.
Yeah.
Sorry to interrupt. Is there any significance to the sequence?
Yeah.
Axis?
It's always 1 through 5. It's a standardized reporting device.
Is it organized by importance or clinical significance or?
It's not any of that. It's a global assessment tool, and it's always done in the same order so that you know when you're looking at it what you're looking at. When you're sitting in and doing therapy, you're going to be primarily focused on axis 1 or 2 because you're going to be you got to make a diagnosis. You have to diagnose people to be able to bill their services for one thing. So it's immediately important, especially to the agency. So you're going to be trying to think, is this an axis 1, a clinical disorder? Is it a psychosis or a neurosis? If it's a psychosis, you're pretty aware. Or are you getting into a personality disorder? And then if you're dealing with mental retardation, you're kind of dealing with a different field. But you would use the same device, okay? And it'll always be the same. Every disorder has a number code. And those are the things that you have to provide to be able to bill for a service. Like for Medicaid, anybody to pay for it, they want to see you've got to have a diagnosis established that makes sense, okay? So it's not like axis 1 is more important. It's a different category of consideration. And all of these things are important because it's important too. In axis 3, a general medical thing, you may have a guy with he's got a sore throat or something, but you may also have somebody that has like a stage 4 cancer, which absolutely impacts all the rest of this, and you need to know that and be aware of it if you're going to try to provide any kind of treatment. Okay. Okay, here are the things that will go under axis 1. and then there will be numerical codes for each specific. But they include, this is the way they run them, which if you start looking at this, it makes sense, or if you look at it, you know, enough thousands of times, it all kind of makes sense. But Axis 1, you're trying to determine disorders usually diagnosed in infancy, childhood, or adolescence, excluding mental retardation, which goes in Axis 2. Okay, delirium, dementia, amnesiac, and other cognitive disorders, other thinking type mental process disorders, or thought process disorders. Mental disorders due to a general medical condition, substance-related disorders, schizophrenia and other psychotic disorders, mood disorders, anxiety disorders, somatoform disorders, physical manifestation of physical symptoms due to a psychological condition. Facetious disorders are people that are faking it in whatever fashion, you know. Munchausen by proxy, where the mother tries to make it look that the child is incredibly sick, is an attention-getting device by her. That's a facetious disorder. Hypochondriasis, where people are faking it to get attention, that kind of stuff. Dissociative disorders, these are like multiple personalities, or people that are having a dissociation type issue. Sexual and gender identity disorders, eating disorders, sleep disorders, impulse control disorders that aren't classified somewhere else, adjustment disorders. Adjustment disorders are to anything. You know, anything that you experience can cause an adjustment disorder. You get kids, they get an adjustment to school. People have an adjustment to disability. Somebody has his leg amputated, he's going to have some pretty serious adjustment disorders and probably some other things going on like depression and, you know, whatnot. And then other conditions that could be a focus of clinical attention. There's something that doesn't fit in here, which isn't too many things because they have it pretty well covered. But anything that somebody would walk in with that doesn't fit, you could still put it in Axis 1 and just specify what it is.
But what's a sleep disorder? Sleep, it can't fall in sleep? Or what's the problem?
Correct. You got people that can't fall asleep, they're having insomnia. You get people too with like night terrors. You know, they're where they can't stay asleep. They're waking up early. They're waking up in the middle of the night. And usually not due that they have a bladder or a prostate infection and they have to go pee. That's probably not going to go in here. Although if you had somebody with sleep disorder and he has a prostate infection, you probably noted it as medical condition because that's going to relate to how many times he gets up at night. But it's not a mental thing, it's a physical condition. But there are people with sleep disorders to the point of like suicide. You know, they're exhausted, they can't continue, and they cannot sleep.
So like eating disorders, you can either way, either you don't like eat and or eat too much.
That's correct. Yeah.
Okay.
Yeah, you've got people that are, Karen Carpenter died from starving herself. Where do we go? Axis 1 continue. Whoops. Okay, the personality disorders. This is Axis 2 now. So if you're not dealing with a psychosis or a neurosis, you're going to start considering if somebody's in a lot of distress and somebody's having a lot of problems, and also a lot based upon how they present, you know, what they say to you, how they try to deal with the therapist or anybody in their world. You got paranoid personalities, schizoid personalities, schizotypical personalities, antisocials, borderlines, histrionic. Histrionics are always real demonstrative and theatrical, like narcissistics, very focused on themselves, avoidant people, dependent personalities, obsessive compulsive, personality disorder, not otherwise specified, and then also on Axis 2, but not a personality disorder, is mental retardation. There's somebody else here. Wow.
And then we find back out.
What's that? See how many people we got.
I think we lost Rebecca, and now she's back.
Oh, okay, okay.
Yes.
Is there anybody?
Sorry about
There's
that.
nobody. That's okay. 02, 03. Okay. What was I doing? I was talking about access to. So you have different personalities.
Okay.
What? Personality disorders are not crazy, okay? They're not psychotic and they're not neurotic. Personality disorders are like a pervasive style of personality that they've developed over a long period of time, and it usually starts in adolescence or young adulthood. But they're so not common, but they're so characteristic that they've been classified into these different areas, because they will end up often in a mental health setting because they have problems, people around them have problems. But those are Axis 2, folks. Okay, Axis 3, this is the medical category. Okay, and this is the way the medical people break things down. There's also an ICD, an International Classification of Diseases handbook, and it'll give you the number for every existing medical condition, okay? Whether it's a prostate infection or it's a neoplasm or it's a broken bone or whatever, it all has a systematic numerical system. But so these are just all the different body systems, actually. And these go in Axis 3, where you're considering general medical, which always relates to a psychological issue. And, okay, there's still more diseases: musculoskeletal, congenital, perinatal, etc., and injuries and poisoning. Axis 4 are problems. They're not really even a specific diagnosis. They're not criteria. All these other things are very specific criteria. You must meet this, and you must have this or that, or you got to have this and one of these three of that part. It's all spelled out in the DSM. But anyway, the Axis 4 stuff, the problem areas: primary support groups, social environment, educational problems, occupational, housing problems, economic problems, problems related to interaction with the legal system, and other psychological environmental problems. Okay? So that's always part of the consideration. If you got somebody that's, whatever it is, psychotic is kind of in the psychotic class, but a lot of the, the neuroses and personalities and such, if he's also looking at he's got a hearing before the judge the day after tomorrow, he's going to be pretty stressed out, or it's somebody that's depressed and he also now has a problem with the primary support group. His wife just left, okay, or his parents disowned him, or it can be anything. But this is an area where you can categorize these things. And building to my first conclusion here, we have Axis 5, which is a global assessment of functioning. So the last thing you do after you establish all this diagnosis, and now you spend some time with this person and you talk to them, you see what's going on, you give them a GAF score. It's their global assessment of functioning. Overall, how's this guy doing? Okay? If he's coming in, and this is like a 10-fold chart, but the top of the chart, the 91 to 100, is superior functioning in a wide range of activities. Look, what's that? Is that somebody talking to me, or is that the TV or something?
I think it's background noise.
It sounds like
It might be the
Chinese
background
website.
noise.
Lacey's sitting there looking at Chinese videos.
No.
I gotta write more reprimands. I'm so far behind on reprimands, I don't know what I'm gonna do.
No.
Huh?
No, I didn't do anything. No. Not me.
Okay.
What's the sound came from where?
I don't know.
You
It
might
sounded
pick
like
up some
Chinese,
background
so
noise from me
Lacey,
at
I
the
don't know.
coffee shop.
Okay.
Oh, somebody's at a restaurant. Okay. That's
Yeah,
fine.
Rebecca had to go to the coffee shop to get to
Oh, okay.
Right.
connect with us.
Okay. So anyway, after you acquire this information and try to apply some judgment to what's going on, you're going to give them a global assessment of functioning, a score, a numerical score. So the top of the rating is 91 to 100. Superior functioning in a wide range of activities. Life's problems never seem to get out of hand. This person is sought out by other people because of his or her many positive qualities. They demonstrate no symptoms. Okay? There's not a lot of people in this category, particularly that you see walking into a mental health clinic. Okay? You might have somebody in the low to mid 90s is excellent. At the other end of the scale, the 1 to 10 category, is an individual with persistent danger of severely hurting himself or others, such as recurrent violence, or persistent inability to maintain minimal personal hygiene, or serious suicidal act with a clear expectation of death. Okay? So those are your two ends of the GAF scale in terms of functioning from a psychological perspective. And then there's like this whole range in there, and you'll read the criteria and, okay, is he a 45? He's closer to a 50 maybe, that kind of stuff. But another therapist or anybody, physician, anybody that sees your report is going to get a sense of where this guy was on this day when he saw you. From all the things you could try to pull and make the best diagnosis you could to a rating of a functional ability. And those things change. And then diagnoses change too. Like you have to do this on day one. You meet this guy cold. He comes into your office, and you got to be nice enough to him that he's not going to stab you in the throat with a pen, because you don't know who you're dealing with, and you're trying to elicit information about usually sensitive topics. Also, people are defensive. They're angry. You don't know what you're going to get. But anyway, this is the initial activity of somebody that's seeing someone in a mental health setting. So that's why I chose this as my initial presentation on the Happy Healthy live virtual classroom.
Wow.
So how was it? Lacey, I know she was sitting there watching Chinese videos,
No.
Trying to encourage me.
No, but for me, it's totally very difficult to understand.
Yeah.
Of course, English, my English also, the content for me very difficult.
Right. It's
不用等一会儿我关。
It's also, Lacey, it's its own thing. It's like if you go to any specialist, they're going to talk their own language. They have their own way to categorize things that's meaningful to them. So if you go in to see a physician, a medical doctor, they're going to do the routine blood tests, the things that they do. They're going to have heart rate, blood pressure, et cetera, et cetera. If you go see somebody that's in mental health, they're going to be doing this. If you go see an engineer, Joel's going to look at something, and it's going to be temperatures and stress factors and, tons of how many millivolts of something to make something operate. So everybody kind of has their own way to document and keep track of what they do, and that they know what they're doing, and other people know. It's a way to communicate. Except, you know, sometimes people are interested in mental health stuff because everybody goes through, well, am I nuts or am I okay? Or, you know, my wife is totally nuts. I need to get her locked up somewhere. Or on the joking aside factor, I don't know what to do with my aging father. You know, do I need to have this person in a facility for his own safety, or the safety of us or the grandchildren, or you know, whatever it is? And those are the things people go through every day, or a lot of people go through, and a lot of people's things reach the point that they're in this kind of setting. But that's what this kind of setting is about. So that's why I thought to do it first. You know, it's kind of a basis. And then I did another one. I started doing this evening about an hour before we were due online, because I like cut grass and stuff all day. I did my Qigong therapy all day. I'm building this, like, you know, Garden of Eden out here, this therapeutic facility, and it's becoming a little bit challenging too. Yeah, my Qigong therapy. It's like while you're raking the yard, you got to stretch your back and stuff. Lacey's on me about it. She wants me to live forever. And if I show any weakness at all, she's on me about it, you know? So I try to work stretches and walking around into some of the things that I would like to do to make this place look nicer. So anyway. But here's where I started to, when I did get my 10 minutes to make a new slideshow, I came up with this. Obviously used the same format. Lacey's things with the acupressure and the exercise and such, we have a particular slideshow format that she's used, so they kind of match. And I was trying to make this different. But anyway, mental health talking points. It's like, what are we going to talk about, okay? Mental disorder definitions. You hear this a lot. This guy's psychotic. No, he's neurotic. You're neurotic. Or your personality disorder, okay? Those kind of three terms are thrown about. People usually don't know what they're talking about. A psychotic, in the narrowest definition of the term, is restricted to delusions or prominent hallucinations, with the hallucinations occurring in the absence of insight into their pathological nature. Okay, so you're either hearing things or seeing things or often smelling things that aren't there, but you are not aware that it's not there. You believe that it's real to you. Okay? So this guy, if he's hearing voices, those voices are real. He thinks there's stuff talking in his head. Okay? If he's seeing things, he thinks it's really happening. Extraordinarily dangerous people, because they don't know. They're usually terrified. They don't know what's going on. And if you approach them or you try to control them, you got to really be prepared to be careful, okay? Now, in a more broad sense, the most broad sense of psychotic, and I put this in kind of as a talking point because I'm so clever, is that most broadly defined psychotic means an impairment that grossly interferes with the capacity to meet ordinary demands of life. So there's a lot of stuff like that. So if you want to, you know, in the broader sense, probably most of us get to the point of crazy on not frequent, but, you know, that you have things that are pushing you beyond your capacity. So those are some considerations. But the difference between a psychotic and a neurotic is the neurotic maintains connection with reality. He's not having anything happen that isn't real. but he exhibits behavior, including thoughts and feelings, that cause distress and often inhibit successful functioning. This guy's like so depressed, so deluded. He's not psychotic, but his life is just a disaster because he's consumed with this. He's also difficult for other people to deal with. If you're dealing with a really neurotic person, it gets tiring. And then in terms of tiring, the most exhausting individuals on the planet are the personality disorders. Okay? Personality disorder is an enduring pattern of experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, and has an onset in adolescence or early childhood, is stable over time, and leads to distress or impairment. Okay? So there are lots of different categories of personality disorders that have different characteristics or different manifestations. And a histrionic person is going to be always flamboyant and flared, and a antisocial person, which you see more in males, are people who have zero conscience. They just have absolutely no sense that this is going to cause you great pain or great difficulty or great disappointment, any of that. That is not in their mindset. So if you find yourself in a situation, and because these are typically guys, antisocials are usually guys. If you're a woman comes in and she's having problems with the marriage, and she starts describing a guy with antisocial personality characteristics, she's not going to be able to fix that. You know, because this guy, he's in a different plane than she is. He doesn't care what she thinks, and she thinks, everybody thinks other people share their values. And that's why we get into so many conflicts with other people, why it's so difficult to have close relationships. These people don't have the same values, and you're not going to change them. So if you're gearing your life around, I'm going to change this guy and make him into some generous, appropriate person, it's not going to happen. Anyway, that's kind of that consideration.
So they can't be fixed?
Personality
So
disorders? Personality disorders probably are the most difficult and the least likely to show significant change. Psychotic people can show a lot of change, particularly with some medications that can help. It's still undetermined. There's increasingly findings are showing that these mental disturbances are chemical, neurochemical. Okay, it's this element of the brain. It's serotonin. It's whatever it is. Okay, but also because that's an area we can do research, so it kind of lends itself. But anyway, and psychotics too. An example of a psychotic is a guy that thinks that he's controlling the basketball game on the television. Okay? He thinks that he's controlling whether that shot goes through the basket, the time, the game, what everybody's doing in that game. That's very real. There was a guy like that in Marianna, Florida. That was just one of his problems, okay? Well, one thing you want this guy to do is turn off the television. You know, either turn it off or walk away from it. Try to get away from that because it's maddening to him. You know, these people live often in torment. It's like being trapped in hell, and there's no out, and there's nothing they can do to control it. But anyway, I don't know how do I even get into that about the psychotics. Kind of that they're psychomedical, chemical pharmaceuticals that have made a lot of improvement. But there's also cognitive behavioral treatment that you can try to help people shape how they react to this stuff. Because what you really get in trouble for is your behavior. You don't get in trouble for what you're thinking. you get in trouble with how you react to your boss, or how you react to your teacher, or, what behaviors are you doing when everybody else is sitting studying and you're up, peeling skin off your finger or something, whatever. So there are things that can be done to try to shape some of that. And then, what else did I do? The other thing that crossed my mind is it goes along with the multiaxial thing a little bit, is typically you're trying to determine dangerousness, and when you see a lot of people for the first time. And typically, too, if you get in a position, usually everybody has to take call for, late night, middle of the night crisis stuff. So you go out and do an evaluation. You're going to do a diagnosis. You're seeing this person you've never seen before. And one of the things that absolutely you're trying to do is determine dangerousness. If you establish dangerousness, that person can be confined in at least most states that I've been in for 3 days in a behavioral health facility involuntarily. Okay? They can be taken in handcuffs or restraints against their will, and they can be placed in a secured facility for up to 3 days. So you get into it enters a different ballpark. There's like a thing where if somebody comes in to see you for therapy, okay, they can choose to come back or not. You get called out to see this person, you're going to violate his civil rights. Okay? If you make a determination that there's dangerousness, you absolutely are violating him, and that he is going to be, if he requires it, he's going to be restrained and taken somewhere against his will. So anyway, when you get into trying to, what you're trying to determine is the likelihood of whether this person is going to cause physical injury or death to himself or other people. And that's the dangerousness determination. You're going to consider his mental status, everything you know, everything you've seen and listened to, his history, his present behavior, his expressed intent. If he's telling you, I'm gonna kill my wife, I want her dead, and it's pressing, or in regard to his own suicide, and then you go by whether he's got a motive, what his motive is, his means, does he have guns at home, does he have guns in the car, depending on what he's gonna do, does he have a car, and does he have a plan, and how kind of specific and detailed and determined is his plan. So you do this when you get called out, and the contrast to these would be, okay, you go in an emergency room in a hospital, and you got like a 14-year-old girl, and she took 8 Tylenol, okay, and she says she wants to kill herself. Most likely, you can't really generalize, but there's a good likelihood as you pursue that, she's trying to manipulate a situation, get some attention, do some things. She's not dead, She's not even close to death. There was a guy also, and Mariana must really fester some of the choice crew. There was a guy that was probably 50-ish that he came in, he needed evaluated. He had like a 7-year-old daughter. The cops were coming to question him about a report that he had sexually molested this 7-year-old little girl, his girl. And then on history, he had previously had an accusation one time, but it never went to fruition. He was never arrested or prosecuted. But this is a guy that's already had this suspicion raised. Currently, there are people saying that this happened, this just happened. And this guy says he wants to kill himself, okay? So he's got a pretty good motive. And then his plan was that he was going to drive to the Chattahoochee River, which is on the interstate from Mariana, about 20 minutes. The interstate goes over a place where they do these huge hydroelectrical dam thing for generating electricity. and these used turbines are accessible by vehicle that you could conceivably jump into, okay? So somebody that tells you his plan is he's going to get in his car, go as quick as he can to jump in a giant turbine and have himself chopped up, that guy got to go for 3 days to Panama City for a behavioral health evaluation. He's definitely high risk of dangerousness to himself, you know. And that concludes my initial slideshow presentation.
Hey Clay, backing up one slide.
Okay,
Um,
wait a minute. Wait,
yeah.
this one? This.
So, yeah. So, are the personality disorders beyond the reach of cognitive behavioral therapy?
No, they're not. But they're so habituated, and they're so pervasive, and the personality that develops probably isn't going to do what you say anyway. I mean, there's 8 million reasons that you sit and talk with these people about how they could have handled this differently. And why would they want to have handled it differently? That it would have been a more positive outcome for everybody, everybody'd still be happy, that kind of stuff. They're probably going to do it again anyway. And the tendency, my inclination, is to see that generally they tend to become worse the older they get. It's unlikely that it's going to get, but yeah, it can be treated. And there's somebody, if somebody comes in and says, you know, hey, I got to start doing something differently. I've totally messed up my life. You know, my mother hates me, my spouse hates me, everybody hates me, everybody at work hates me, and I keep doing the same stuff. What can I do differently? You'll get sucked into having that same discussion, and they'll go out tomorrow and do the same thing they did yesterday, most likely. But no, it is subject to a cognitive behavioral type of treatment, where if you can modify your thinking about your behavior, and you're either motivated enough, or maybe this person has finally gotten to the point where they are willing to change, you know. Yeah, Jen.
I was curious about Rebecca's standpoint on that. Rebecca, what's your experience with art therapy there?
Where'd Rebecca go? Is she still here? Yeah, there she is.
Yeah.
Okay. I can
I
see
can't hear
Rebecca
you,
talking,
Rebecca.
but I can't hear her.
Oh, there we go. I could hear her before.
Yeah, I wonder if she's got a plug loose or something in her.
Can you send her a text message? Not a text message, but can you send her?
Oh. Yeah, can
On
you
a
type in
whiteboard.
the
Oh, yeah, there's
in
a
the
thing
chat
down
on your
the
app,
left.
Rebecca?
Send her a message. Somebody send her a message.
He disappeared. Can't hear.
I can't hear you. Can you just, I don't know if you can type to us?
How about just re-log in, see what happens?
I don't know.
Your voice very clearly. Maybe she can hear us,
So we get her back.
No.
but she's still. Oh,
Which one is she? 03?
Yeah.
yeah.
Let me see if this.
Oh, here, she's typing to us, so.
Is
She on
it?
the whiteboard.
Oh, there you are.
Okay, I redid her broadcast. Can you hear her?
Okay. I can hear her.
Oh, can you guys hear me now?
Yeah.
Yeah.
Awesome.
Okay.
I've had experience working with people with borderline personality disorder, as well
With what?
as schizophrenia on meds and off meds.
Yeah.
Borderline personality disorder and schizophrenia off meds and on meds. So, and that was interesting with the medication on leveling out of the people. And then those who were off meds were usually kind of in that constant state of psychosis.
Without the meds. Without the meds, they were in
Yeah.
the psychotic state. Yeah. Yeah.
Yeah.
And then a lot of times too, people get in treatment and they take their medication, they seem okay, and then you let them go and they quit taking the meds, and then you're back to, same stuff.
Yeah,
Yeah,
had a couple of those.
Yeah.
Oh,
go ahead.
What was your question, Tim?
Oh, I was just going to say that my friend who is finishing up pharmacy school at Lee Common Erie, she actually is doing a presentation about long-acting injectables with that population and how that can help them, because then they give them the injectable and it lasts. And while insurance companies don't want to cover it as much because it's more expensive, it actually saves a lot of resources because they're not going constantly into the hospital whenever they're off their meds.
Yeah, which is wonderful. That's like a time release thing. If you can embed a capsule where you can give an injection that's a long-term time delay, it solves, well, it doesn't maybe solve it, but it certainly helps with that problem. Because constantly, if you're working in a clinic, you got inpatient people, you've got an inpatient setting, and then you got outpatients, okay? And then people that might be seen at home. At the outpatient clinic where you're doing a lot of therapy, same people keep showing up. As long as they keep taking their meds, they may be okay. But if they're living in their home, which is why also a lot of people end up in a group home where there's at least somebody there giving out the meds. Whereas if you let this guy go and he goes to his single room, wherever it is, he's out of touch. People don't like to take pills. They don't like to take medication. And he's going to say, hey, I'm feeling okay. I don't need this stuff. So he gets off his medication, and where he's going to show up is probably in an emergency room in handcuffs, because the cops are bringing him in because he's down on the street corner scaring people or whatever he's doing. So any longer-term administration method is wonderful. She's probably excited to be working in that area, I would think. So how did the borderline personality disorders make out with the art therapy? You said you did.
It was interesting because she didn't really. For my internships, I did art therapy with people who were chronically mentally ill and chronically homeless. Mm-hmm. So I worked with that population. And worked in a stable setting where, in order to be in the facility, you had to have chronic mental illness and chronic homelessness. And I worked at a drop-in center, so anybody can just kind of drop by all we have. With the borderline, she didn't really want to touch on that. I tried to go into the cognitive behavioral therapy, but she wanted to work on more of issues in her PT stuff.
She wanted to work on what?
The loss of all.
stuff with her PTSD
Yeah.
and issues in her past versus actually
Yeah.
the here and
She's
now
kind of-
issues that were caused by the borderline.
Yeah. And she liked to talk about what her problems were and all that at length, I'm sure.
Yeah.
Yeah. I had a
So
psychiatrist
I tried to
friend.
at least focus it.
Yeah, right. But I had this friend who was a psychiatrist also in Marietta, Florida, and he used to say, if you have one borderline personality in your caseload, you have a full caseload because your phone never stops ringing. They never run out of issues. And there's just always mountains of problems and chaos, you know. But the focus is always on them.
Yeah,
It's
I
their purpose
definitely
on the
understand that.
planet. Yeah, that's like what they live for.
Yes.
Interesting.
How you
Art
feel?
I
therapy.
did have some success because I helped her. I was able to help her deal with the flashbacks she was getting, so
Yeah,
there was some success at least.
good. Very good. Art therapy is remarkable, really amazing. And music therapy is amazing, too.
Mhm.
I would
Yeah.
guess there's a lot of that we don't even understand. Like with the music, probably there's neurological things going on. And maybe with the art, too, even in like looking at it and interpreting it. It's, you know, I don't know, but it's amazing. And it's very amazing with like an MR population. It's phenomenal. It's just a modality that you get people to respond to.
Definitely.
Yeah. How are we doing with this? Huh?
I'm
What do you
learning.
think?
Good.
Joel fell asleep. He's going to
Joel's
have to
learning.
get another reprimand, probably. I'm sure he will go through a class without a reprimand. He's one of those guys, you know.
Hey, I've been very well behaved.
You've
I
been
do have
doing
a
pretty
question.
good, yeah.
I have another question.
What's that?
I have another question.
Okay.
Is there a common symptom or expressed behavior that's common to all the personality disorder classifications?
Is there a common behavior that's common to all of the personality disorders?
Yes.
The first thing that would come to mind would be that everything needs to focus on themselves, but that doesn't apply absolutely not to the antisocial folks. I'd say there's a commonality with some of them. And the other thing too, Joel, you see like mixed personality disorders. It's like a lot of it'll blend together. You know, you've got somebody that's a borderline personality that meets those criteria, but you'll quite often find elements of other disorders that are prominent with that person too. But there are always a lot of trouble for other people. I mean, if that's a category, I would say they're troubles.
I think the commonality is probably how much they affect your life.
Well, that has to do with your relationship and how much control they get of it. You know, depends on how close you are, what an impact they can have on your life.
What about the neurosis? I'm not sure. I understand where the psychosis fits because that's expressed with hallucinations, and those probably can be managed with pharmaceuticals.
Often,
The hallucinations,
yeah.
right? The dopamine inhibitors in that class. And then, but where does the neurosis fit in?
Well, the neuroses are going to be less severe, and you know, you get a lot of depressed people. People show up because they're depressed, you know. So you're not going to get people, not so commonly, are you going to get a psychotically depressed person. You know, his depression's going to be in the neurosis range. He's not picking up on anything that isn't really happening, but he's pretty depressed from, you know, whatever, a level something to a level something higher. And he can also benefit by medication, but he can also benefit by therapy. And my focus was always like cognitive behavioral stuff, because I came from a behavioral background. Okay, if you can shape or adjust your thinking, you have some hope of doing that, and then you might have some hope of actually following what a treatment plan or a behavioral plan is. And that people have greater and lesser abilities to follow that, and people have greater and lesser motivation to follow that. You know, if this is making my wife angry, and I don't really care about her anyway, I'm not really motivated to change. You know, but if this is making my wife so upset that she's threatening to mark out the door, and I really do care about her, you know, want her to be a major part of my life, then, you know, maybe I need to try to build some different habits, different thinking habits, different behaviors that'll make that be more positive for both of us, and then you can kind of heal them, possibly, you know. So it depends on circumstances and people's, you know, people have different degrees of tenacity, stubbornness and strength and stuff. And some people don't care what you say. You know, they don't care what you say. When you listen to this guy and you tell him, okay, what do you think? You know, there's probably a problem with that or whatever. And some people don't, you know, they don't care. He's only there because his wife said you have to go to therapy or I'm going to leave you. You know, and it's going to cost you $5,000.
Poor people, court ordered.
So yeah, okay, he goes in and signs up, but he doesn't care what you say. So I don't know if I'm answering that or not. I don't think so.
No, because I'm trying to. Okay, I understand how the personality disorders affect. They're mainly concerned with the way people interact in a social context. And the psychosis affects basic functioning because of these hallucinations, auditory, oral, auditory, visual, tactile, those things. But I'm not sure. What's the neurosis? I can't see the slide. Maybe not.
You got people that are not in a psychotic state, okay? They're not hearing or seeing anything that isn't there. They're not smelling anything that isn't there. They've got some pretty serious problems in terms of their perception of where their life is. You know, a lot of depressive people are depressed to greater or lesser degrees. You got a lot of somatoform illnesses where, you know, my stomach hurts, I've got diarrhea and constant headaches. You know, I've got these, and it's physical, it's not in my head. You know, and so well, yeah, it's in your head because we've done all the medical testing, there's nothing there. So it must be, you know, that it has to do with how you're interpreting your life and your functioning within it, kind of thing.
Okay, so the neurosis is more associated with depression, anxiety type.
Yeah. Anxiety, depression, dissociative disorders, people that split personality type, not a split person, or multiple personalities, because they're dealing with situations that they develop a coping mechanism that's like most of us would find unacceptable, and it leads to a lot of problems. But it's a neurosis. It's not really crazy in terms of, you know, I mean, crazy is a non-term. People talk about, he's crazy. It means absolutely nothing. There are mental disorders. There's also insanity, which is a legal term. It's not really a mental health.
Okay.
So the next slideshow needs to be a breakdown maybe of some of the neurotic disorders and some discussion about what those would be about. Might be a logical progression from here.
Yeah, I'm interested in the personality disorders, but I think the psychosis. Those aren't the people you're likely to encounter in daily life. They're probably institutionalized.
Yeah.
They're also medicated.
That's right. They've already been snatched off the street. Most of the psychotics, they're somewhere,
But the neurosis and the personality disorder, people probably people who know and interact with them on a daily basis.
That's who's going to make your life miserable.
Yeah.
And that's who you're going to run into. I mean, other than, then there's like normal people who are bad things too. But everybody fits in this stuff. You're like shades of this or shades of that. And you'll, like different times in your life, you kind of fit into different categories of things. And it has a lot to do with what's going on in your life, the events you have to deal with. And it's circumstance. And it's also kind of your evolution, I guess. But you go through a lot of that. I mean, there's anybody who tells you they've never been depressed and they've never felt inadequate is lying. Okay? Now we're in the facetious stuff because that's a crime. There isn't anybody that doesn't struggle with this. Maybe there's a difference in the degree of the struggle, perhaps. And there's a difference in the degree of the struggle in the same individual in different circumstances.
Clay, I know you had mentioned passive-aggressive personality. Is that one you're going to break down in the future?
I did.
Or
you know what? It's not included in the DSM-4. It's listed as a not otherwise specified. Okay, good. Passive-aggressive personalities. We'll check it out. It's in here somewhere.
All right, I'm going to get my door here real quick.
Okay, everybody go pee.
Hey, close the door downstairs.
Close the door downstairs. Okay. I even have notes on this for Joel. And everybody disappeared. Where Lacey? You got to keep an eye on Lacey. She slides out. Yeah.
Come say hi.
She's getting.
Here, wave. We're on camera.
Who's that?
My mom.
Hey, how are you?
There's Rebecca.
Yeah.
I haven't seen your mom in forever. I'm good.
So anyway, given that Lacey's hiding somewhere, passive-aggressive personality disorder is page 733. I ain't had notes on this because I know Joel would want to discuss it, okay? But it's not included as one of the personality disorders in the DSM-4. It probably isn't DSM-5 as the current one. But anyway, it's listed as a not otherwise specified. But the features, the essential feature is a pervasive pattern of negativistic attitudes and passive resistance to demands for adequate performance in social and occupational situations that begins by early adulthood and that occurs in a variety of contexts. Okay? These individuals habitually resent, oppose, and resist demands to function at a level expected by others. Okay? It's usually expressed by procrastination, forgetfulness, stubbornness, and intentional inefficiency, especially in response to tasks assigned by authority figures. Okay? They will also, when a problem arises, tend to blame their failure on other people. So that's a passive-aggressive personality. And then, you know, like the aggressiveness of it is the subtle aspect that I'm not going to jump up and hit you because I know that doesn't work and that's not my style. What I'll do is undermine what you're trying to do. And that's my aggression. You know, so you get it coming out at work, in a work setting, say, a passive-aggressive person. I'll make sure I don't do my job, I'll mess it up, and that'll cause the boss to have a problem. Or I resent the authority, I don't care, I want my paycheck, but I'm not going to do what they want done. So I'm going to sabotage it or not do it as well as I can, or I'm going to do it real slow, or I'm going to whatever. Okay? So you always have this passive-aggressive stuff. And in interpersonal relationships, you often don't want to, a lot of people, they don't want to confront somebody directly, but they're not real happy with what you did. So what I'll do is something you don't like, or I know you won't like it, or you'll find it annoying, or you'll be disappointed, and that's the aggressive nature of it. And you're doing it passively instead of directly confronting somebody. It's a pretty good strategy. I employed that a lot. You know I've done that for decades and decades of time immemorial, man. I've done my share of passive-aggressive stuff. You know, I'm pretty good at it. If I want to mess up your deal, I could probably get into that.
So, Clay, how did you go about treating that?
Passive-aggressive personality. My basic approach to personality disorders is that I know that I'm going to sit there and take up a lot of time, and they're not going to do anything but get worse. Okay? Along with most of the other people you see in the mental health field. Seems, you know, after looking back on a lot of it. But, you know, you need to, it's an educational thing. It's like psychoeducational. It's a cognitive behavioral approach. If you can make somebody aware that this is what you're doing, and this is how it's being interpreted by other people, not your scam or your, you know, smoke that you blow about it. This is what you're doing, and this is the impact it's having on your coworkers or your wife or your whoever it is that you care about. If you live in a cave by yourself, none of this matters. It's when you get involved with other people that it becomes important, and particularly, and it makes their life difficult. So you would try to focus on, okay, how'd this week go? You know, he comes in again. You've already seen him 8 times. He's back. It's next week. Okay, how'd your week go? Well, it was pretty good, except, you know, my wife made me mad. She did this. And then it'll be that he did one of the same things he's probably always doing. So you try to point that out to him, that maybe there could be some learning take place, and that somebody could then modify their behavior, which is the whole nut to this entire everything we're trying to do. It's like Lacey doing her acupressure and healthy food stuff. It's getting people to change what they do. You know, pulling teeth is a piece of cake. You know, at least that could physically be done. If you hold their head down, you can pull their tooth. But trying to get them to change a behavior, you know, you want them to go stretch their back because it'll make their back quit hurting. You know, you got to hold a gun to their head. Or you need a taser. If you had a taser, you could do a lot of behavior management, but it's frowned upon. You know, you can't use it on the clients, and the other people around you start getting, you know, depending on how many volts you got in there, they're not going to like it either. So it's like you could make anybody do anything, and you could fix anything if you had absolute control. You know, if you had absolute control of their reinforcers, you could make anybody do anything, pretty much, okay? But given real life, where, well, Yeah, I could change that and my wife would be more happy. But I don't want to change that. You know, it's not really worth it. So she's a little bit upset. She'll get over it. Or not. What's she going to do? She's trapped here too, you know? We've been together for 47 years. We got 18 grandchildren. Where's she going to go? I mean, you know, people do all this stuff constantly. But the only thing, you know, therapeutically, I think to do with them is to try to make them aware of what they're doing and the impact it's actually having on their life. You know, is it worth it to you to keep this style of behavior given that it's having this impact on other people? I kind of think that's the sum of it. The SUM of it, you know, in a nutshell. You know, a couple years ago, I made a comment. We take a lot of digital pictures now that there's digital pictures, you know. So we got like thousands of pictures we take all the time, Lacey and I. And I made a comment one time. I said, Lacey, we're looking through these pictures we had taken. I said, Lacey, I look crazy in all those pictures. I look like a crazy person. And she said to me immediately, it's always immediately, she says, well, all those years, did you think you were changing those people? You know? Yeah. Which is probably pretty accurate.
Did you?
Huh? Yeah. I just changed myself. I adapted to them, you know? Yeah.
Problem, like, you know, I don't, you know, totally out of my career. So, it's like what you talk about, like personality disorders or autism. So you think can be improved by, you know, like reading some self-improvement,
Yeah. It can be. And it depends on that person, you know, the patient, the client, whatever you call it. It depends on that person. And then that's also the challenge of doing mental health. If you can perceive something and get an insight, if you can share an insight with that person somehow, if you could make them see what they're doing and how it's the effect it's having on them and everybody, sometimes they might actually change. So the whole thing, like every day that you do, is try to listen to what people are saying and see what they're doing, their whole behavior, posture, all that. And then you're trying to find a way of something that could be said or something that could be set up that they might be able to make a change. And the tendency is it's not probably going to be immediately a big change. It's probably going to be maybe gradual. Although there are also big changes. You know, people stop stuff cold turkey. You know, people stop smoking or drinking cold turkey. And some people could change doing a behavior if they've gained enough insight and understanding of themselves and how they were doing it. They could change that. It's like getting you to stop and think before you say something. You know, you're dealing with kids with a lot of behavior problems. If they just stop for a millisecond, just pause, a flash of a moment, and think about what you're doing, you might choose some different behaviors that makes everybody's day go a lot better. You know? Sunshine.
I had this one client. Who was court ordered to be in my art therapy rehab group. And for weeks, she just kind of slept in the back. And then all of a sudden, she just had that epiphany or that insight of, I want to change. And then started participating and really working towards it. And the last time I saw her, that because of the group, and she had done so well, that she was actually able to get out of the program.
Very good.
Um,
Congratulations. You
and
had
it was
a
just
moment.
really
You had a
amazing.
moment to get the thing.
I mean, I don't know where she
Why I
is
did all
now.
this. Yeah, that's why I study all this stuff and listen to all
Yes.
the, stuff that I listen to. Because
It was
occasionally
actually
somebody gets there that
pretty amazing.
Yeah. Yeah.
It was pretty amazing to see her go from sleeping to really participating and making actual changes in her life.
Yeah. Good.
Yay,
What else
that
can
story.
we talk about? Huh? We're doing pretty good. We got an hour and a half class and nobody fell asleep. Lacey walked off a couple times, but at least nobody nodded off,
Good.
Fell out of their chair,
That's right. You catch the people. You catch the ball. Wow.
Huh? What's
I
that?
was surprised. You catch the people. I saw nobody show up.
Yeah, I know. You
I
told
saw
me
you.
that before I left the other day, just to make sure I wasn't completely hammered into the earth enough. You had to tell me that before I left to drive back over here. And nobody's going to show up because nobody cares about that, right? Yeah. But Lacey's so clever that it's part of her manipulation deal with me. She knows how to work it. Yeah. But I was really glad I turned it on. I turned it on and Jen was here, man. Oh, what a relief. Yeah.
I know. I'm actually gonna have to go, but thank you. This was fun.
Well, thank you for coming. Absolutely.
Yeah. I would like to participate in more stuff. So if you have,
is there a
make sure
better
that you
time
share it.
for you? A better time or
It's fine.
Okay.
It's fine.
I was thinking like not work but not late.
Yeah.
So okay. So I need to get into what would you be most interested in, like we can talk about stuff. Joel was talking about neurosis.
No, personality disorders.
Personality.
I think they're tough, but I'm really interested in them. I would love to learn some more about, I don't know how to make people more aware of that.
Make people more aware of what?
Of their, like, if they're passive aggressive, how do you get them to that point of enlightenment? I understand they have to do so much of it. It's really them wanting to change,
how do you
but
confront them with it and let them know? How do you slide that into the conversation? Hey, I really care about you, but geez, where is my nerve pad? I recommend nerve pads. You go ahead
nerve
and
pads?
nobody gets hurt.
Okay.
We're going to start selling nerve pads on the website for about $18 a piece.
Okay. There's an episode of The Simpsons a lot like that.
Probably, yeah, I can see. Yeah,
Mm-hmm.
but that's good. Things about how do you try to work this into conversations with people that are your friends or coworkers, or because there's always a lot of sensitivity involved.
Right, and I think. Yeah. I think other people might be interested in that too, as far as their relationships go and how they can improve them.
Yeah. Okay.
Yeah.
How to confront people, how to tell people.
Maybe how topic, how to build good relationship in the family. How about that kind of topic?
Relationships in the family.
Yeah, how to build good relationship, how they can improve their relationship, what they should do, how they working on that.
Well, that's And that's the thing, too, that Jen's talking about. Like, how do you tell somebody?
No,
obviously, this person's causing some annoyance, or you wouldn't be thinking about it.
No, you have to
Yeah,
talk.
you know, it's either your mom,
Not just
you know, and then you know they're going to whack out whenever you say something. You know, because your mom's going to say, hey, all I ever did for you, and look at how you repaid me, and you know, all that. And she's still
no,
there.
you have to
Oh, I
know
get that all the time.
No, just it, no.
Yeah, she's not listening because I had it on so she could hear it, but then I can't talk.
Oh, okay, good. But, you know, yeah, all that. And it's like, you know, how do you tell somebody something? You don't want to hurt their feelings. But it's like, you know, it's really bothers you. It's got to be, you know, it needs to be dealt with.
Yeah.
But anyway, and that's the stuff we all deal with day to day, every day.
Yeah, I think that's valuable for a lot of people. That might be good. But like I said, I'm going to have to go, so it was fun. Everybody have a good night.
All right, thanks, Jen.
Bye, Jen.
You have a good day.
See you.
My first live virtual person.
Oh, wow.
Oh, I couldn't believe it when she was there. Oh, man. Somebody showed up. I expected Joel, because you said, you know, you've known about it. Lacey told me she was going to be too busy. So anyway,
Jen had
Rebecca showed up for the art therapy.
she put the link out and
What's that?
Jen had put the link up and had suggested the class, and it's definitely
Okay.
interested, so
Did she do that
glad I
on
got it to work.
Facebook? Is that on Facebook?
yeah.
Is that's the other thing, Rebecca. We're trying to figure out how to get stuff to people. You know, the whole point to set this classroom is that at least it's accessible to anybody anywhere with internet. You know, whether you're down the street
Yeah.
in California. But, you know, how to get it disseminated. And then I think we're at a point, too. Lacey and I have been trying to push this for a while. But it's like now trying to get enough content together to have something to present. And even if it's not really together, just start doing it and make it better. You know, I think.
Mm.
So anyway, I'm glad you made it. That's wonderful. And I'm glad you had some
too.
success with
It's
your
nice,
art therapy. That's great. Yeah, good stuff.
Yeah, my internships overall were very successful.
Good.
And unfortunately, I haven't been able to really practice since I've been out of school.
Really?
But I've been working as an art. Yeah, I've been working as an art teacher for people with developmental disabilities. So at least it ties in a little bit and
Yeah.
stuff.
It's the same
That way.
thing, right? If you're doing developmental disabilities teaching art, you're doing art therapy, right? Is there a distinction there?
We don't go into it as much, but it touches on it. It's more art as therapy versus
Yeah.
art therapy.
Yeah, okay. Yeah. You're not going to get as much analysis of something, but that modality is particularly effective with that population. You know, they're going to get more out of that than they're going to, you know, than a lot of things. I think that's great.
Yeah.
Yeah, very good.
Thank you.
You're welcome.
But I have to get going as well.
Okay.
And
We're
I will
glad you made
definitely, I'll have, keep updated on more classes and try to join.
Okay. And if there's
You guys
email
plan
me
on
or
having
something,
more,
and I
right?
can send you directly if you want or whatever, you know. Check in
Okay.
through one of our multiple
That sounds great.
unfinished websites. Yeah. TheHappyHealthyClub.net and HappyHealthyInc.com, man. We got stuff everywhere if we could just get it together, you know.
That's the one I signed up for.
Good.
Okay, sounds great.
All right, you have
Thank
a great one.
All right.
See you.
See you later. See you later, alligator.
So with 3, you can make a big, okay, yeah.
Holy shit, people showed up.
He not really changed it right away.
What? I don't think so. Those people did an hour and 39 minutes of mental health stuff. Very good. Well, I'm glad I took a shower and brushed my teeth. Holy shit. I thought it'd be just me and Joel. I was sure it would be just me and Joel, you know. I thought the LCT doesn't care if I take a shower or not, you know. Yeah, I put on a clean shirt, everything. Huh?
How about your mask? Still not so black, different from the picture, Jill? It's different.
Yeah, it's exactly what I remember.
Yeah? It doesn't glow quite as white as it used to.
I keep going.
Huh? I see. What the hell?
You cannot see all that.
Let me see, try 4. Okay, there we go. Now we're equal. Like,
You're equal. Pretty good. Good job.
thank you, Sunshine.
Yeah, good, Mike.
Thank you. You think it's worth to do?
I think it is.
Very good. Well, there's lots more bullshit to come, man. We're just tapping the keg now. You know, we'll get a crack in there and just let all this shit fly everywhere. If people are interested. Yeah, we got lots of bullshit.
I didn't think people show up. Pretty good.
Good.
But sometimes they can't hear clearly.
I don't know, Lacey. Like, her thing, I don't know if she was having trouble with her plug-in microphone. And I don't know either. Sometimes it seems like the program like you hear a different sound. Like the echoes or something. I don't know.
I can't hear Jill so clearly, actually.
Okay.
Jill's voice is pretty far
Yeah.
from me. Maybe that's I'm too far away from the computer.
Yeah, probably. Okay. He's further back.
Okay.
You know, like I'm using a headset. He's talking to a computer that he's sitting back in a comfortable chair, so he's not right at, you know.
Oh, okay.
But it seemed like the sound was pretty good tonight. You know, you could hear what we're talking about. The classroom work.
What's another lady's name? Rebecca?
Rebecca.
She not clear.
Yeah. And
so
she was delayed. She had a pause. You had to wait, because when you were hearing her sound, her lips weren't moving. Then her lips would move later. And that could be the speed of her computer. She was using an iPhone. So it might be from that, you know.
Oh, really?
Yeah.
Okay.
Yeah, she was at a restaurant. She was down at the Coffee Cup restaurant in Florida using an iPhone.
Okay,
yeah, we're like broadcasting all over the planet now.
I think, Lacey, a lot of the problems you hear with the sound are related to the internet connection, each person's internet connection.
Yeah.
I don't think it's necessarily a problem with the application. I think it's bandwidth.
That may be, Joel. Yeah, it may not be the application. It could be their equipment or their bandwidth, like either. Yeah.
Because as soon as I tried to open up Wikipedia, you know, I don't have a high-speed connection. I have the middle grade connection. As soon as I tried to open up Wikipedia, the voices started cutting out. I had to close it.
Okay.
Yeah.
So it's a bandwidth thing.
That was a local bandwidth issue, and I think, you know, you get 5 people, you're dealing with 5 different bandwidths.
Yeah.
You come through very clearly, Fred.
Good.
Yeah.
Well, I'm pretty goddamn happy myself. I see that as a major success. Yeah.
Very good.
Good. Yeah, really, Joel. I thought it was going to be me and you, and that was okay too, because I thought we'll work out bugs with the program like and stuff, and then talk about what to try to do in the future and everything. But that's great. A couple of people showed. We'll be rich soon.
So who are the two women? What are their affiliations?
Jen is Sally Faust's granddaughter. Sally that used to come here every Sunday, one of the Jehovah's people. Jen is her granddaughter who comes here once in a while. She's opening a photography shop in Ligonier. In those new places that they're finishing.
I never saw that she really interested in this kind of topic. I never saw that.
She landed on our website the other night. On our new website, the happyhealthyinc.com thing.
Yeah.
Because I'm messing around with it, and holy shit, there's a person there. Or no, I got an email. I get an email if somebody joins. So, like, right away, I go running in and get on there. She was there. Yeah.
Oh. It's the New York one?
Huh?
It said the people join from New York. Is correct?
No, that's somebody different.
Okay.
I don't know who that was yet. I haven't heard back from them.
Yeah.
It might have been
I don't know.
Her name was Rebecca. Maybe that was it. Agent R, she said. She called herself Secret Agent R. That's probably Rebecca. If I'd have thought of that, I could have asked her if she's a secret agent, We could have talked spy shit for a while.
So how about your next topic? What?
Joel's topic.
Your next plan topic. No.
My topic.
How you continue? Yeah, you continue your today the project. You continue talk about next time.
Well, the two things that stimulated the most interest were personality disorders and relationships. So I guess I got enough material for two next sessions, or split it up or whatever. But
Yeah. And I think you have a lot of experience, about your clients. Maybe when you talk the topic or something, not just give you can give the example from your clients. You can give with the person what the story. Maybe more cause people attention. Also, maybe help them, like me. Maybe help me easy to understand what is the real meaning.
Yeah.
Give the example from your real case, your real.
Okay.
You have so many people you deal with the past so many years. You give the talk about this kind of personal, what is the personality disorder, another disorder, different kind of disorder, what belongs to this kind of disorder. You give the specific person example. You use deal with. So then came out with a story.
Right.
Yeah,
it's more interesting. Huh?
Yeah, that's good.
Yeah,
and it helps.
Yeah.
Like tonight when I mentioned about Dangerousness, the 14-year-old girl that they're everywhere. But the guy that came in that was going to be accused of sexually molesting his daughter, that son of a bitch.
Yeah, you give some example. Yeah, but I think because this kind of stuff maybe for almost people in other career difficult to understand. For me especially, English problem also this content I don't understand. But if you give the example from the experience your patient before, it's helpful and make more interesting and easy to understand. I think.
Okay.
And also I think maybe later we'll get into what personality disorder or something, how to build a relationship and maybe how to fix it, what way how to fix it.
Yeah.
Absolutely.
Yeah.
Mm-hmm.
That's worthwhile stuff to do. That's the stuff people deal with every day.
Yeah.
You go out, you got to deal with personality disorders, and you have to deal with your relationships, which is probably the most demanding thing to do.
I don't know. like a relationship, you first you have to bottom line. You both have to sit down there, not just argue. You're right, I'm right. You're wrong, I'm right. Not about that. And then you have to sit down, seriously communication. So first decide we want to together, continue together or not. I think basically first the question have to agree. You want to continue live together, be life partner together or not? And so yes, okay, yes, we continue decide. No point to communication, no point to deal the problem. If you already agree each other want to continue together, lifetime, you have to learn each other, try understand each other, try improve yourself, both of them, not only one person. I think basically.
Yeah.
Well, right?
I'm glad to see you getting into this stuff, Lacey. Yeah. Very good.
And we have been discussed with Jill how many times, Friday evening, you have to have something in common, have to have something like a mission together, working on the mission. The first setup, you want to be together or not? Okay, together. And then another important thing is, have to have similar mission, not just focus on each other. Focus on mission, both focus on mission. I think maybe, I don't know if you want to put this kind of things in your next project or not. I think it's important, set up the same goal, same direction, same mission. They will help a relationship because they want to improve themselves, how to they fix themselves to this mission. I think if help people recognize that, maybe help them improve relationship even.
Definitely.
Yeah.
Maybe you should do the next session on relationships.
No. It's my personal opinion. I don't understand. No, it's too deep for me now. It's just my personal opinion, and from
absolutely.
my experience, from our together experience. Also, we discussed with Jill about this. I feel it's just personal opinion. I don't.
Yeah.
Nobody.
Well, it's like, if you're doing therapy, you got people come in for marital therapy. And I used to tell people on the first day, I'm not here to keep you together. It's not about you two enduring each other and suffering through and wasting your lives.
Yeah.
It's about, if you can make this work or not. If you can't make it work, you need to be out of there yesterday, But if you want to try to...
Yeah, but I think... nobody perfect. But you have to, how many percentage you both fix each other. If you have 70%, you're okay. But the 30%, you can improve each other. You can learning each other, and then by communication, how to make the work out, I think. If you totally different person, totally different value, no mission at all together, just don't waste the life. Just okay. And I don't think you need to waste the time to try change others. Not necessary. Yeah, no. Yeah, so I have to basically something.
Yeah. Life is short. So.
Yeah. It's like a Jill, you have to find the right woman match you, at least they eat popcorn in the evening.
Right.
Pardon me?
She's saying you have to find the right woman to match you, one that'll eat popcorn in the evening. But then,
Right.
Lacey, he maybe doesn't want that, because then she'll eat all his popcorn. He should find a
Oh, yes. Oh.
He needs a woman that likes pretzels. And then she can eat the pretzels, she eats the popcorn, everybody's happy. Huh?
But definitely, I think if you focus on that kind of topic, so many people, they suffer from relationship, more than 90% even. So I think if you focus on that topic,
mostly everybody.
People,
Yeah.
Yeah.
mostly everybody at some time or another, and people more or less, you know. Some people it's all the time,
Yeah.
their life is miserable. Some people sometimes have problems. And everybody has like day-to-day stuff that's like, well, I'd rather you did it the way I do it, but it's okay, you know,
Yeah.
it doesn't matter.
But they still, still let them recognize them relationship worth to spend the time to fix or not.
Yeah, of course.
And,
Yeah, if it's
the
minor
person that
stuff,
has
you can either decide to fix it or you can decide it doesn't matter. It's like, you know, people argue about whether they should put the toilet paper roll, if the toilet paper comes out from the bottom or it comes out from the top, and it's like, you know, I really don't give a shit. But if I put the toilet paper on the roll, it will come out from the bottom. But, you know, I'm not going to get pissed off if you change the toilet paper roll and I didn't have to do that and you got it like coming over the top and stuff, you know, like I'm going to get all pissed off about it. I don't think that's going to happen. Although a lot of people, of course, would. And a lot of people's lives. Huh?
That should be the personality test.
Yeah.
Toilet paper, overhand or underhand?
Yeah. It's critical, man. I could write a whole goddamn thesis about that. You know, analyze people's personality based on how they put their toilet paper on. You can tell a lot about people.
I think that kind of person, they nothing to do. I think they are not busy enough.
Well, it's like people like me that analyze that kind of stuff. You think I don't have enough?
No.
Huh?
No, you misunderstand. You misunderstand what I talk about. I mean, if the couples fighting with that kind of small things, if people fighting or argue with that kind of small things, they just not busy enough.
They either need to find something to do or they need to pack their shit and get out of there. You know, go somewhere else, one or the other. Yeah, of course. And I'm not going to tolerate too many arguments about how I put the toilet paper on a roller either. You know, I'm only going to listen to that about twice. And then I'm either going to get pissed off or it's just going to go right through. But I'm probably not going to change it unless you could convince me.
I have another opinion.
Okay.
I think, if you design, not just my opinion, if you design the question, first question, second, let them ask each other. Then after they answer the question, they know what they should do already. You know what I mean?
Are you talking about the people in the class or like people generally?
No, you talk about how to build a relationship and another something. And then sometimes, people don't need to discuss, just answer the question. Then later, after answer the several really important questions, they answer that they can figure out what they should do usually.
Yeah. I do like a survey, of course.
You understand? I think
one thing you want to know is how they put the toilet paper on a roll. And then there's another group of people that some people squeeze toothpaste from the end and some people squeeze in the middle. Those people fight with each other too. So you got that.
Yeah. No, I mean, for example, the many couples together, they only have issue or something. They argue, they fighting or something. And I think if this kind of people, they have problem, at your how to improve relationship, this kind of topic, maybe if you design several questions, maybe help them go this direction. First ask question, you want to, like the woman can ask the husband, you want to continue live with me together, or the husband first answer this question, then first put them together. That kind of question.
Yeah, like to evaluate the relationship to see if it's working.
Right. And then they answer the yes. When they answer the yes, they will go more closer. They will go same channel. If they say no, okay.
Yeah.
So they actually, once they both answer yes, or they come out the question, come out they are both mind, how I can figure out, how we can try figure out improve our relationship. Because bottom line, we still want to together continue. So they kind of question.
Yeah.
And they can continue that side.
Torture each other too.
Huh?
Some people stay together so they can torture each other.
No,
They want
I think
somebody
if
to
you
mess with.
don't have the kind of training, you don't have to. No, you have to lead them go the together relationship. You want to improve. You can find yeah. At least have like a standard, kind of evaluation. They work together.
Right. Yeah.
Because I forgot, I read some book like this kind of interesting before. I forgot. But from after you answer your question, then you done. You know how you should do.
I'm glad you showed up, Sunshine. I thought you were going to be too busy. Remember, you told me you were going to be too busy. You didn't want to have to do this tonight. You got stuff to do, you said. Huh?
Yes, definitely. But I sacrificed myself, and Joe sacrificed himself and support you.
I understand. You guys sacrificed yourselves for my bullshit. I appreciate it very much, of course.
Oh, you don't have to appreciate it. Even Joe already said that be relaxed. He will support you completely. Wow.
Right.
I was so.
Yeah.
More
Lisa teared up, Joel, when she got that. When I told her you sent that message. Because I've been getting stressed out about this shit, between the websites and the place and the goddamn grass and everything, in the restaurant.
Yeah.
And then I get a message from you says, relax, I support you completely. I showed Lacey, she's like all teared up. I said, it's like all you need to know. I mean, that's all there is, The rest of it's detail.
Yeah.
Yeah. But if you think about it in your life, you can, how many people say that to you?
Not so
It's very difficult.
You don't hear that every day, for sure.
No, in your life, even how many times you can hear that? Once, twice, so far I never heard exactly Joe I heard. And I still remember just, you have anything, just let me know, I will help you, everything. I thought really I told my mother, told Lucy, I said, really I'm so lucky. I never heard before, no Joe, anyone told me about that. Just this enough. Not means I order, trouble or something. I don't want to be trouble, but it's just you heard that. It's enough. It's really. So that's why I told Joe is our gift.
Yeah.
Yeah.
Yeah, we have to support each other in our mission.
Right.
Oh,
That's the only way the mission
going.
gets anywhere.
Yeah.
Any progress.
That kind of stuff's really good to hear too when things are like, oh my God, Jesus Christ, when it's either crushing down, it's any of it, whatever it is, you're tired of washing dishes or you're tired of driving back and forth or you're like, nobody's going to pay attention to this shit anyway. And then, like I finally got to this weekend, Joe, I got to the point, I don't care if anybody listens to it or not. I'm going to get up and give the speeches. I don't give a shit if nobody's there. I'm going to keep doing what I want to do. They can either come, don't come, show up, hell. That's what we do. We work the mission. So we're going to keep working the mission until we go in a box, After we get put in a box or an urn or some shit, then I guess it's over. Unless we figure out how to hook up next time.
Yeah, that's oh wow.
Yeah. But that's become my philosophy recently. I'll try to do the best I can, and that's what I can do. That's it, folks. You know.
That's good. You know, the people try to do them best, the most important.
Yeah, absolutely.
Just yeah. So how was your vacation?
It was nice. It was nice.
Okay.
Did you go on
You
vacation?
came back.
Yeah. Christ, he's
Well,
like
I'm-
Barack
No,
Obama. He goes on vacation every other week. Am I the only guy working around here?
Yeah, I went to see my brother and
Yeah, the baby. Sylvia.
Yeah.
Hey, you know, your first picture holding that baby, Joel, left a little bit to be desired. I hate to tell you. You know, I don't like to crush people completely, but you gotta hold their head up for Christ's sake, you know? Get a stick or something to prop it up.
Well, yeah, then I took some to my brother and it was
Yeah. Yeah. That was great. Very good. You look like you
And then
like
he disappeared after that.
happy. Yeah.
Yeah,
And
she's a nice baby.
Good.
She doesn't cry much. I never heard her
Cool.
cry.
Wonderful.
wow. Must be another intelligent.
Yeah, she's
Yeah.
busy thinking stuff.
Yeah.
She's very well behaved. I hope that doesn't change.
Good.
Yeah.
Mm.
Yeah. That's nice.
Very nice. Yeah. So you had a good time.
Yeah, I did.
Very fun.
So how did you come to blow your stupid ass up? Huh?
Oh, okay.
God, that's the best video I've ever seen, maybe.
Yeah, that's
Jesus
great, isn't
Christ.
Oh, you're so surprised.
Oh, I loved it. I played that 20 times.
Yeah.
That's really good. It looks like it blew your ass up. You're gone.
Yes. So, you know, I told my nephew, you know, okay, so you take, because I understood how the video worked. I said, okay, you take the video and then I'm going to duck out of frame. And so I just ducked behind the couch.
Yeah.
It looks like I've
But
been
the stuff
annihilated.
blowing up covered the ducking part.
Right.
You could see that you ducked.
And there's
You know,
another
it's
one.
like you're gone.
Yeah, there's another one where I teleport. I teleport into the living room.
Oh, yeah.
I hadn't posted that one. It's yeah, I had as much fun with it as my nephew did.
So, you design that
No, that's
program.
it's an application for a smartphone. It's just somebody created that. I don't know who.
Yeah, pretty clever.
Mm.
It has
Yeah.
other effects
Yeah.
too. You can blow yourself up and do other stuff too.
Yeah, there's one where a robot attacks, and
Robot attacks.
there's one where a robot attacks you and blows you up. There's one where somebody shoots you with a gun and you blow up. There's a flying saucer. There are a whole variety of effects.
How about getting
So,
eaten by a shark?
yeah.
Is there anything like that?
I didn't think of that. Yeah, I didn't. Probably somebody made one.
Yeah, probably. Yeah. Oh, that was good. I loved it.
You get into the computer now.
Yeah. And then the comment, of course, you know, that you had uttered an expletive in church, you know. So I need to know what'd you say? I need to know.
Yeah.
Interesting. It's good. So you back to work. How about your work? You can work just yesterday, right? Yesterday.
Yes, just yesterday.
Yes.
Just
Yesterday
yesterday.
on Wednesday, yeah.
Really busy. Really busy.
Oh. But
That's not a bad thing.
Hey, I'm gonna go
Keep
pee.
out of trouble.
you say you trouble. You okay?
No, I said when I'm busy, I stay out of trouble.
Okay, yeah, everyone, not only you.
Yeah.
That's good. You focus on your work is really good.
Yeah. I had to focus on work because it's been really busy. And
That's
shower.
good. Good. So you enjoy that?
Yeah, I enjoy it, usually. Although I'm ready for the weekend.
Okay. Ready for weekend. You miss whiskey, huh?
Yes, I do.
You didn't drink whiskey at your brother's house?
No, I did. I had some whiskey.
Okay.
Yeah.
So what is special activity there? What you did there? 4 days or 5 days?
What did we do? We went to different places. My brother and I went to a couple different places. And we just, mostly it was just relaxing. It was not a lot of, it wasn't very crazy. But everybody enjoyed that.
That's good, family together. Yeah. They at Ohio? Where? Ohio?
Cincinnati.
So how far drive to there?
6 hours.
Oh, it's not close. It's a little bit
No,
far.
it's not close.
So close to ocean or something? Or in the mountain?
Say again?
So they in the mountain also, mountain around, that's the area?
No.
Oh, okay.
Now, it's kind of similar to Pittsburgh. It's a little bit similar to Pittsburgh in some ways.
So it's like a size like Pittsburgh such kind of size city?
Yeah, it's about the same size.
Okay.
So
weather.
it was hot.
Oh, really?
It's hotter there than here.
Oh, really?
Yeah.
Oh, so the winter, they better than here should be.
Yeah, the winter is better there.
Oh, that's good. Oh.
So what did you do?
Wow. These couple days? Oh, we nothing special actually. We can, same Euro restaurant, and Monday just relaxing. We didn't do anything. But the Monday even didn't do anything. I just feel exhausted. And then yesterday come back and this is just a normal lab work. And then today everyone got, like we lab come new people. Then everyone had a presentation, of course. But I present my own, own things, a little bit. This is funny, yeah.
I thought the presentation was Wednesday.
Say again?
I thought the presentation moved to Wednesday.
Yeah, Wednesday today. How you know it?
Okay.
Yeah,
Okay,
Wednesday. Yeah,
that's
she changed the meeting from Monday to Wednesday, so that's why we did the presentation. But not so long, just short presentation, introduce education, training, background, and career goals, and research interesting. But I said some I will do some what I'm doing now, develop acupressure training materials or something like that, and for diabetes or something. Yeah. And then my supervisor, she said her life mission just try figure out fat like a lipid droplet fat store in the body, where store in the body or where go.
What?
I said Harvard. She said I talking to Jill about the presentation today. I said Harvard said her life mission is to try figure out the fat, the molecule, the lipid, the gel,
Yeah.
the wire store wire in the body, wire go in the body. Then on micro pronunciation, I said, Dr. Kershaw said, her mission is figure out the fat store in the body, where in the body, where go in the body. But my mission, my life mission will be, I will cut fat go in your body. Get it? Get it?
I get it.
Yeah.
Okay.
Kershaw's got to figure out where it goes. You're going to prevent it from getting there. Yeah.
Yeah, correct. You want to figure it in your body, I will stop the fat go in your body.
It'd be easier not to put it in there because you know where it's going.
Correct. Yeah. I said, kind of
your belly or your ass.
I said it's my mission. Yeah. Figure out the food. Healthy food is kind of cut fat, reduce fat, stop fat go. At least reduce fat go in your body. And she try to figure out the fat in your body, where is the liver or somewhere, and the muscle somewhere, and the store somewhere. I said I will reduce stop fat, try the body. I said kind of against the Dr. Kershaw. I said maybe you're not so happy, But everyone laughing. Just we had to start at home. Yeah, pretty interesting. I have tomorrow another day.
Yeah.
Yeah. So maybe Jill better go to bed. He has to get up early. We don't
Joel
look like
has
a
to get up early. See, she's going to start telling you when to go to bed and shit, Joel. See how it works?
Yeah.
Well, I just, Jill has to go to bed. He's shy to leave, and
He's
because
not shy. He doesn't give a shit.
No, he doesn't want to hurt your feeling. Right?
No, I don't think that's it. No.
What time get up? Oh.
6 o'clock.
Wow.
Yeah, pretty early. He need to go to bed.
See how it is? Yeah. Shit, I get this every day, all day, Yeah. Go to bed, get up, do this. Don't do that.
No, Jill, you just, and I just, Jill very thoughtful. And he doesn't want to hurt your feelings. He had to stay here. And he need to relax. And go to bed early. He has to get up. What is?
Oh, I just finished charging my Kindle. I was going to read tonight.
Okay, well, good, yeah. It's very nice to see you before Friday.
Yeah.
Yeah. It rarely happens.
Yeah. He has a fighting with project tomorrow.
Oh, yeah? Yeah.
Mm-hmm. Right? Yeah.
Yeah, well, several projects.
That's good, though. It gives you something to do, man.
Yeah, that's what I was saying today. It keeps me out of trouble.
Right.
What else would I be doing? I'd be getting into some kind of trouble.
You could be thinking up stupid shit, to go out. Oh, I think I'll go out,
Yeah.
How that always works out. Another good idea. Yeah. That's why I try to stay on the leash, man. I know where I'm safe.
Jill doesn't need it. You need it.
Oh, he doesn't need a leash.
Jill has a
leash. He needs a leash. Yeah.
Oh, he's different.
Yeah.
Yeah, it's looking that way.
Yeah, of course.
No, it doesn't have to you better.
Yeah.
You don't need it. Yeah. He's different. Yeah.
Different? No, he's not. He's worse than me.
Oh.
Probably. Yeah. Yeah. He does crazy shit. Like, he blows himself up on videos and stuff, I don't do crazy shit. Yeah.
No, he's clever. Huh?
Did you see that video? Did Lacey
Yeah.
talking about?
Yeah.
Yeah, then it disappears.
Yeah.
Yeah. He
I
showed me
showed her
last night.
last night, Joel. She tried to look at work yesterday, and they have Facebook blocked on the UPMC computers. Yeah, which makes sense.
I couldn't,
Yeah, so I showed it to her.
mhm.
That was good, man. That was well done. Like, where in the hell is Joel?
Yeah,
You know, I thought about putting it on Living Here Living, so I can't find Joel. What the hell? Yeah.
be careful. He will put it in your website, everything. You have to be careful.
Yeah, be careful.
Yeah.
I'm been known to do that.
He really very impressed. Yeah. Wow.
I'm glad you enjoyed it.
He
Oh,
was,
I loved it. It was great.
Oh.
I couldn't believe it when I saw it. Holy shit, it was good. Well done. You were gone. There was no, like, you didn't see you, like, sliding under the couch or anything. You just blew your ass up. You know, all that thunder and stuff. And it was like, yeah, it was great.
And we did that in one take, believe it or not.
Really?
We only needed one take.
Came out really well.
Yeah.
It's a keeper. Oh, I laughed. It made me laugh so hard. It reminded me of seeing Lacey the first time she dyed my hair. She laughed so hard she had tears coming, and I can't see it. You know, I'm like, holy shit, how bad could it be? Really be bad. She laughed so hard she had tears running. I'm like, oh.
yeah. It's just so funny.
Yeah.
I like this. It's so funny. Yeah, now it look like a reincarnation. You know, like after reincarnation, he like that. Totally different person. And I like it. I really like it. It's good. Much better.
Yeah. You look totally different.
Oh, sure.
Yeah.
And then she talked me into
And then
putting
you
it up on Facebook. I put that on Living Here Living in Facebook, too. I had like 93.
You carry the mental problem book.
Huh?
Yeah. You carry you hold the mental problem
Yeah,
book. Yeah.
holding my mental health Bible, you know. Yeah.
Yeah. And it's good. I will do again this Friday morning.
Good. I look forward to it. Makes Lacey laugh.
Jill, go to bed, Jill.
He doesn't want to go to bed. Yeah.
No, he needs.
No, he doesn't need.
I know.
Leave him alone. He
It's
doesn't
not
need it.
Friday. No, you don't go work. You know, he has to go work morning.
I go to
6
work.
12 hours.
I worked
No.
all day.
You get up late. You stay late. You know, you stay late until 8 o'clock. He has to get up 6 o'clock, 2 hours earlier than you. And he especially, go work different, stressful. I know because I'm working too. Different from you.
Just
You're
you
not
two.
standing.
Just you two.
Oh,
I'm
God.
supposed to feel bad for you two because you two work and I don't. You should.
No. We go work. You just sitting around, different. You're not stressed. We have stress. Different. We have to go the direction specifically. You don't have to go any. You just decide, what direction you go. You can walk around the house. It doesn't matter.
Yeah. Right. That's true. I like it that way.
Right.
I take smoke breaks whenever I say. I say whenever it crosses my mind, it's smoke break. Yeah.
So we're different.
Retirement has its privileges.
Yeah. Retirement.
And the Jill get up earlier than me.
Huh?
I get up 8 o'clock, 7:30.
Hey, I get up
Oh,
before
wow.
you do. I'm always up at 7, Lacey. I'm
Yeah,
up.
but
I already did a bunch of stuff.
you get
before
up.
You get up. Yeah, well, yeah.
And then you
I'm up thinking about what I'm going to do, I got a certain number
And
of
then I will
cigarettes
have
I
to
gotta
party.
smoke. I have to make coffee. I have to go to the joy room.
You see
I
how
got stuff. I got stressful. Yeah.
Hey, is it L&M?
No.
Menthol?
Yeah. They're the best, man. They're the cheapest. They're the cheapest, too.
Oh, yeah?
Well,
Is it menthol light or is it regular menthol?
Regular menthol, short ones. I don't like long cigarettes. They piss me off. They're not right. They don't balance properly. There's something wrong with that.
Oh, okay.
Yeah, the filter's
just
bigger
put down
anyway. We're talking cigarettes now. This is a technical discussion. See, you don't know anything about this. Yeah. We're going to mute you out. We're going to put you on mute till we get done talking about cigarettes.
It's not Friday.
No.
That's
It's Wednesday. Tomorrow
Yeah.
is Thursday.
Yeah. So tomorrow evening, I just go. We go. Tomorrow evening we go to the restaurant. Yeah. So tomorrow is my last day.
Yeah.
Yeah, that's actually nice.
Absolutely. That helps
Yeah.
a lot. Yeah.
So you're not so rushed on Fridays.
Yeah, but Friday morning, yeah, yeah, then class. But I'm okay. We'll keep going. Yeah.
Keep going, sunshine. Stay on mission. Whatever it is.
Yeah.
You know,
Yeah.
keep doing it.
Yeah. Well,
I got to write a
we have
book
more
by
topics.
Christmas, Joel. Did I tell you?
Yeah.
Lacey, you know, last year I asked her what she wanted for Christmas, and she told me hope in the future. So I learned not to ask, right? So I didn't ask. So the other day she told me what she wants for Christmas. I didn't ask. Nobody asked you.
Yeah, but
What the hell are you telling me that?
I know. But
She wants
you
me
know,
to write
you don't
her
have
book
to
to
figure
have
out.
it published.
I need a present from him. Book, a speechless book.
Oh, okay.
He had 4 months. Yeah, because we can. If you write a book, can publish on the Amazon or tell you how easy. Maybe we save the topic for.
There was a lady here that's self-published on Amazon, and her ebook is $2.99. She writes like fantasy fiction shit, you know, like a long ago fantasy world and the people were in love and all that. And her ebook is $2.99, and you can get a paperback for $10.99. And they have gotten the process to the point that somebody can order one book, they print it and send it out. So it's like on demand. It's print on demand. Yeah.
Wow.
You just give them content. They do for you. You don't have to do anything. It's so easy. You just need the content.
Yeah. And on the ebooks you get like 90%. And she said on the physical book, the paperback, you get less because they have so much expense, you know, the paper and all that.
The nice
They have
at least 50%.
a printing machine now that once they have the e-file, they just send it through and it does as many copies as they want. If somebody orders one copy, they run it, print it, and ship it. Yeah, it's pretty goddamn cool.
Yeah, so now we are the.
Yeah, we gotta get some
That's why. Correct. Yeah, that's why now we're on the writing the book channel. Last weekend you're not here, so I want to present from him Speechless. The book title is good. Not just talking, you know. I'm tired of just listening somebody running the mouth. I need action. I need a result. So,
She has 4 months to deliver, huh?
yeah, it's easy because he has a lot of stories, speechless story. I can help him. I have story. Tell him he just write down very easy. So title right there. And my book, I will get the 12 meridian stuff together. I try get done by Christmas time. Then next year I finish another one. And I don't know, live soup pretty good, but so far I only have 2 stories. This maybe. Really, Joe, if you want to write a book, you need a book.
Here you go, Joe. Your leash is about to be jerked. You're going to have to write a book for Christmas. She's building up to this. I can tell it's coming. What are you going to instruct Joel to write by Christmas? What's he have to write? Huh?
I have tried to project from him, but I don't know.
See? Yeah.
Yeah, she'll have a project.
Yeah, it's coming. She just hasn't told you the details yet.
No. I mean, we just talking. You have the idea we saw that we recognize the good idea. We just keep doing. We keep doing that. You will saw the result. And this, I don't. You just have to make yourself sit down there. Each day you couple hours. I think you can do. Yeah, it's not difficult for you.
See, it's not difficult for me. I just
no, you really have, you are right. You writing good writing skill. You intelligent, clever enough. I think your write is really good.
Yeah, she comes a little bit of smoke with it. She blows some smoke. Yeah.
No, I just recognize that. And after that, you feel good. At least you accomplish the same.
I'll feel so good if I get that written. Yeah.
Correct, yeah. And I think very unique. This unique book, nobody, you accumulate others think about this stuff. And I have another book title just this weekend, big question mark. I will talk, we'll discuss the big question mark on the Friday evening. Today, quit talking.
Oh, okay.
No.
So you're going to discuss that Friday evening. That's the one you're going to nail Joel with, right? He's got to write.
No, I talk about
Huh?
No, I can do with competition.
What?
Huh? What did you say?
I said I'm trying to get Joel.
You solve your speechless stuff.
Just focus on my speechless and leave him alone. Okay. Yeah.
Yeah.
We have a lot of.
What do you say?
We have a lot of material to cover on Friday.
Yeah, we can discuss.
Holy shit. We're going to discuss happy, healthy Inc. and all that shit. Wow. You better close the rest. I'm fixing up my Qigong therapy world out here in the backyard, man. I did Qigong therapy all day. I got it down. Yeah, it's a whole new approach to all this stuff.
You're multicast.
So
I'm multicast. Yeah. I'm really multi.
You did good job with tonight.
Huh?
Yeah, I can tell.
What's that?
Yeah.
I did
You
good
did
job
good job tonight.
Oh, tonight?
Yeah, just don't hold it. Yeah. Jill need to go to bed. Right, Jill?
Thank you, Sunshine.
Yeah, I think I am going to bed.
Okay.
Yeah, it's not about I like talking to you, but I think tomorrow you have to get up early. Don't want to stay late.
Yeah.
Friday you can.
She's getting you leash trained, man. It's like when you first put the dog on the leash, that dog's pulling and shit, everywhere. And then they start, they come along. They get the idea about the leash. Yeah, she's getting you leash broke.
Some point anyway, right?
Yeah. It's all for your own good, too. Of course. It's all for your own good.
I know Jill don't want to hurt your feelings, so I saw the fall.
Okay. So
Right?
we all gonna go to bed